20 minutes past 10. Good morning, Malaysia. Otto here coming to you live from Angkasa Puri, Kuala Lumpur. Also live on TikTok and also Facebook. We have a special guest in the studio. His name is Dr. Wan Abdul, Hannan Wan Ibadullah from the public health. He's a public health medicine specialist from the Disease Control Division of the Ministry of Health. And we're talking about National Immunization Program 2025 and much more. Thank you very much for coming to the studio, Doctor.
Thank you for having me, Otto.
Now, without further ado, let's just dive into it because we have such a little time and we have been talking off air like non-stop already. It's an interesting topic to talk about vaccine. Now, can you explain just a bit about vaccine?
So what is a vaccine? I would say from my own perspective, vaccine is the strongest public health prescription. It is the most powerful tool in prevention of the diseases. So if you look at the vaccine, how does it work then? So vaccine is a way to enhance our natural body responses, immune body responses, without actually causing our body to have the disease itself. So basically what we do is we introduce a vaccine which in the form of inactive microbes or virus or bacterial that would potentially just initiate a little bit of response so that our body will then initiate our own antibodies. So these antibodies will be produced in the body. They're like the army of soldiers that will, in future, in case we've encountered the bacteria or the viruses, we will then better prepared in terms of preventing before the virus takes over the body. So I guess just allow me to explain a little bit more on that. In the year of 1974, WHO founded a program called Expanded Program on Immunization. So this is a pivotal moment, especially in the 50 years anniversary. So half a century, this has been introduced. Initially, what we had was just 7 diseases preventing 7 vaccine preventable diseases. Now it has improved, gone up to 13 global VPDs that's already been in the program, in particular in Malaysia. And what we see now, what the vaccine has helped us through, back in 1974, with over probably 4 billion people, back then only 5% kids or infants received the first year of DTP vaccine. And at that time, we see that the infant mortality rate happening in 1974 was almost 100 deaths in every 1,000 live birth.
Wow.
And the life expectancy back then was just 50 years old. It's around that. Now in 2024, with over 8 billion people in this world, and now that we have around 85% globally who has received the first dose of DTP in the first year of life, the infant mortality rate has gone down to just 25 to go through rigorous process of randomized clinical trials, massive regulatory processes before it is being sent out to the community. So it's always the vaccine, the first impression of vaccine is to prevent disease, or even if you got a disease but you have been vaccinated, your body is pretty much well prepared. You have all the antibodies within you. If you ever get the disease, it will be a milder form of disease, not a severe disease that could cause morbidities and mortalities. That is what we want to prevent. Yep.
Now, we are talking, if you've just joined in, we're talking to Dr. Wan Abdul, Hannan Wan Ibadullah, a public health medicine specialist from the Disease Control Division from the Ministry of Health. So should you have any questions for the good doctor with regards to vaccination, immunization, you can actually send us a message on our TikTok, or either go to on Facebook. You can send message there as well, or just give us a call at 0322825491 or 0322824746. Now, we've already known how vaccines are created and the amount of efforts that's being required and the exponential results that has been going throughout the years of tireless work. Now, what are the types of vaccines administered through the National Immunization Program?
Right. So basically, in our Malaysian-owned National Immunization Program, what we have now is 11 product vaccines covering 13 diseases. So it has been given to infant of age 2, 3, 5. You can look at the schedule. So these are the vaccines that have been given. For instance, we have measles combination of vaccine 3 antigen in one. Measles, measles, mumps, and rubella is given at the age of 9 months and 12 months of age. So it is required to have 2 doses to give a full protection against the disease. Some of the vaccines are in the form of combination. What we have, another one is hexavalent, 6 diseases in one vaccine given to infant. So that is our national immunization program. It covers diseases. For instance, it covers tuberculosis, measles, mumps, rubella, Haemophilus influenza type B, pneumococcus. There's a lot, 13 diseases. You can just look through the National Immunization Program schedule, and those are the diseases that's been covered in the National Immunization Program.
Now, that's currently. What about us? During the 80s, like I think you and me are
Yes.
almost the same age. Did
Yeah.
we get that, or has it improved throughout the
We
years?
have gotten that. We have gotten our vaccine. It's just that it was not that robust. Initially, it started with just 7 diseases. Now it has gone up to 13 diseases
Wow.
that have been covered. Yep, we do have received. And to your just to your knowledge, people born in the year of 1970s have gotten, if they get the vaccine, for instance, the tetanus vaccine, they should be receiving the 6 doses required throughout the life. So we have gotten the vaccine. You should never,
I'll skip any of that.
You're not worried.
Okay. Okay, so why is immunization so important, especially for infants, since we're talking about infants as well?
All right. So basically, infant, we know that they are newborn. Their immunity is not that well established. So what we need is to vaccine here is a powerful tool that could help in terms of getting the body ready in case of any infections coming in future. That is one, particularly in infant. But getting through the National Immunization Program, what we are moving towards now is a life course immunization, not just infant and adolescents and school age children, but we're also expanding to maternal vaccination and elderly. And if I may talk a little bit more on maternal vaccination, in particular, we will be introducing Tdap vaccination to the pregnant mothers. What we see now, as we go along, epidemiological burden of disease is important. When we introduce something, we based on numbers and figures and burden of the disease. We don't just introduce vaccines just like that. It has to be backed up by scientific data, in particular for Malaysia. So what we see now is the number of maternity death pertussis among infants of less than 5 months old. When you see pertussis, let me just explain a little bit. So pertussis is given in the form of hexavalent, 6-in-1 combination of vaccine, which given at the age of 2, 3, 5 months. That is the primary series, and a booster given at 18 months old. But most of the pertussis cases, it is a severe diseases if it happens in infant of less than 5 months old. If 5 months old baby get a pertussis, potentially the baby would end up in ICU, cyanosis, and death. And they should be receiving the primary doses, the 3 series, the 2, 3, and 5 months. But if they get infected at the age of 2 months old, even if you get the vaccine, it is not enough for the baby to be protected against pertussis. So what we do now is introduce maternal vaccination, that the pregnant mothers will receive a vaccine, and through the placental transfer, the baby will get period of protection, and it has been proven to reduce the death of infant of less than 5 months. This maternal vaccination has been introduced in high-income countries for years.
Wow.
And now that, Alhamdulillah, we get this opportunity to prevent pertussis death in infant of less than 5 months. That is something we look forward to, and something we should be proud of, that we have the tools in our hand to prevent death in those who are at most vulnerable period.
So has this been circulated already for a couple of years already?
The maternal vaccination has been globally, has been in the last 10, 20 years in the UK and the US. But now we are introducing in our own NIP program in Malaysia,
Wow.
which we should be proud of. Yep.
All right, so we're talking to Dr. Wan Abdul Hannan Wan Ibadullah, a public health medicine specialist from Disease Control Division of the Ministry of Health. We're also talking about National Immunization Program, and we'll delve into that in just a bit. We're going to go for a little short break, and when we come back, we'll be back with more information on regards to immunization. So stick around right here on Tracks. Thirty-three minutes past 10. Good morning, Malaysia. It's Otto here with you until 3 p.m. on Track's Midday Buzz. And we have a special guest in the studio. We're talking about the National Immunization Program 2025 with Dr. Wan Abdul Hannan Wan Ibadullah from the Disease Control Division, Ministry of Health. He's a public health medicine specialist. And we talked about what is vaccine and how has it been rolling out throughout the years and what are the benefits and also the research that had been going through throughout those years as well. Now, Doctor, some think that it would be better if children and adults build resilience naturally and without vaccines, obviously. So what do you have to say about that?
Well, we have thousands of diseases. I mean, we are exposed to all sorts of microbes and viruses around us. Some of the diseases might just be symptomatic and just go off just like that. Some of the diseases will cause you death. For instance, I give you example of cancer. You cannot wait until you get a cancer. Then you sort of like, oh, I should have gotten the vaccine. This is we're talking about human papillomavirus vaccine. So the vaccine is given to adolescents, particularly in female, to prevent the cervical cancer. So some people would say, let's just wait for the natural infection to kick in and our natural immunity sort of like boost protection. In some of the diseases, yes, but some of the diseases, you cannot wait until you get the infection, because once you get the infection, it gets so severe and it's already too late for you to get. And if you ever get earlier treatment, that would be better. But if you fail to get early treatment, early intervention, that will cost your life, and it costs mortality and morbidity. And talk about cancer, you cannot wait until you get cancer. That's the moment you don't, it's no longer for you to have the vaccine, because the vaccine, that is the preventive, that is what the specialty that I'm involved with, that is preventive medicine. You prevent the diseases from happening, and some of the diseases you cannot wait. And we can see that measles, for instance, if anyone with children who get measles infections without having the measles vaccine prior to their life, they will get severe diseases. It can lead to complications like death and pneumonia, end up in ICU, and eventually lead to death. But when we have vaccines, so the vaccine sort of like prepared our body and improve our immunity response towards infections that we'll be getting in. So a lot of people would say, I would just go for our natural immunity. That's not in every case. So you really have some certain diseases. For instance, I give you an example of monumental triumph in immunization. With this vaccine immunization, we have successfully eradicate smallpox. So I have not seen a case of smallpox. Have you seen a case of smallpox? It's very severe, cause disfigurement on the faces, on the limbs, and people would die for that if ever get a smallpox infection. So you cannot wait until you get a smallpox infection. Only then you assume that your body will then react. So now we have no longer smallpox in this world. It has been permanently eradicated. That is monumental triumph in immunization. And now the global is moving towards eradicating polio. So polio is another severe disease that could cause paralysis. If you live with polio, you'll be living with paralysis. Limbs on your limbs, you have to walk with help, and this is what we want to prevent. We do not want certain diseases. Natural immunity does not really help. And yep.
Now, what are the recommendations to parents out there to take immunizations for children?
So the recommendation is always getting through the Ministry of Health and get all the recommended doses, because certain diseases, certain vaccine, you need to have primary doses and a booster doses for you to get the full protection for that. So mothers who sort of like reluctant the importance of vaccine, please do reach out to us, to doctors in the clinics, and ask the opinions on us, further questions on how to address better in terms of the confusions we have had. You know, the vaccine has been proven to be safe, and again, I like to emphasize here, before the vaccine is given to the community, it has gone through massive trials that it is safe to be given to population, and it has always been the benefit outweigh the risk. That is the risk of getting severe infections and death, and that is what our aim is to prevent.
Now, how many vaccines, regardless of age and when we're supposed to take it, how many vaccines in a lifetime do we have to take currently right now?
Currently, we have 11 products, 11 vaccines to cover 13 diseases. But in certain cases, for instance, healthcare worker, what we do get is another influenza vaccine. It is given yearly, and now that Ministry of Health has expanded the program to elderly age more than 60 years old with comorbidities to receive influenza vaccine. Again, when we look at immunization, this is not just at infancy. It is a life course protection. Some of the diseases you might see happening very severe in infant, and some of the diseases very severe in elderly population. Again, as we move older, we get more diseases. Some of us will eventually get hypertension or diabetes. They all put our health at risk and reduces our immune level. That if ever we get infected with future infection, sort of like getting a bit more severe. That is when we get vaccines to protect us.
We're talking to Dr. Wan Abdul Hannan Wan Ibadullah, Public Health Medicine Specialist from the Disease Control Division of the Ministry of Health. If you have any questions for the doctor, you can either send us a message on our Facebook and also TikTok. Quick hello to Christina Chin, says good morning, and Elite, as well as Bunda Laris. We also have Rajesh Tamil Anandi, thank you very much for joining the conversation. And if you have any questions, once again, either drop us a message or just give us a call at 0322825491 or 0322824746. Now, I'm sure a lot of people, there are people out there who do not share the same view as you do and everybody else in the Ministry of Health. But what if, right? What if a child drops out of any immunization? What to do then?
All right. So this is not a new thing for us. We do see cases. In fact, post-pandemic, we have seen increased number of zero doses children. When we say zero doses children, those children who have yet to receive any doses. In particular, in Malaysia, if ever get a child who has dropped out in this immunization, what we can do, we have a catch-up program, which means you need to get into the clinic and then ask the doctors and tell them that my child has lost this follow-up and didn't receive these vaccines. What do? We do have a catch-up program, and we do give vaccines to those who've been missed out in terms of getting the schedule they should have gotten. Yep.
Now, every year there will be a National Immunization Day celebration. Can you explain about the celebration this year?
So globally, what we celebrate usually at the last week of April, 26th to 30th of April, we have a World Immunization Week that is celebrated globally, and with yearly theme. So this year's theme is immunization for all is humanly possible. So this is to advocate the importance of getting vaccinated, to re-emphasize and to not to forget what immunization has saved us throughout these years. And this is really a platform to show that everyone that this immunization or the vaccine has helped us in so many ways, and to better prepare ourselves not to if we ever get any confusion, sort of like I'm no longer need a vaccine. Let's say you have that thought in mind. So this immunization week sort of like re-emphasize the importance of having vaccine and look back what the vaccine has helped us through. Again, what it has done in the last half a century, that we have no longer seen certain diseases. One disease in particular, smallpox, no longer with us. So we really need to make sure that people know that the vaccine works, it saves life, it prevents diseases, and it has helped us in so many ways.
And that's just because, thank you very much for doing what you're doing, and everybody else as well in the health line. It takes years, and you've been in the health industry for what, 20, since 2013?
Yeah.
And so many things you have witnessed. I want to ask you personally, have you seen any changes in terms of behavior or mentality of probably Malaysians are their patients? I mean, the patients. Have you seen a shift into being more healthier, or are they just I don't really care, I can do it myself?
This is
kind
my
of attitude.
Yeah, exactly. This is how my personal experience. I did my houseman in HKL. Prior to that, I have not seen any measles cases that shows us that the vaccine works, until you've forgotten that measles do cause death among children. Now, over the years, in the last couple of years back, so what I see is an increase in number of cases of measles. The reason being is measles is highly contagious. It is highly infectious. If you remember R0, which is how a person who's positive measles could transmit to another 18 person, which are completely susceptible. So one person gets a measles, can transfer the disease to another 18, and usually this is what happens if you don't receive your 2 doses of measles. Throughout the years, I've seen some of the attitude sort of like I don't want to give vaccines to my child, and end up your child's having measles and lead to death. During my years in hospital, I have not seen cases of measles, but now we have seen increased number of measles cases.
Really?
So this is what is important. This is why the immunization week is important, to tell the people that immunization works, vaccine works, it is safe, and it's always benefit outweigh the risks.
And one of the ways that you said it's highly contagious, it could be from touch, it can be from
Exactly.
Mostly touch, is it? Just
Airborne.
Airborne as well.
Yes. Yeah. So if you sneeze, so measles the child could get measles if they get fever, rash, and a coryza, conjunctivitis, and they could sneeze. So the moment they get sneeze, that is when the moment the child sneezes, that is the infections get wild, and it goes into the community. And even more so, if the measles get into a child who is in the most vulnerable period, that is potentially less than 5 months, and the immune system is not yet developed or matured, this is when the infant could eventually succumb to death.
Now, you heard it here, right here on TRAXXfm Midday Buzz National Immunization Program. It is so vital that you update yourself with the right information. Don't just simply be your own doctor, because they are there for a reason, which is our doctors and health officials as well. We're talking to Dr. Wan Abdul Hannan Wan Ibadullah, Public Health Medicine Specialist from the Disease Control Division of the Ministry of Health. So thank you very much for those who are online. Just want a quick hello to Tracy. Pina says good morning, and from Surike, Sarawak, thank you so much. And for those who are online on our TikTok as well. So, Doctor, one last message to everybody else listening in and also viewing us online.
All right. So, Ministry of Health has put up the National Immunization Program, and I urge all the mothers and parents, please get your kids vaccinated, and those who are at higher risk, potentially elderly or pregnant mothers, get the vaccines as is recommended by Ministry of Health. It help you and your family and help the community. And vaccines save life. Yep.
Simple as that. It does save lives. So thank you so much, Doctor, for coming to the studio and enlightening us on how important it is for vaccination. Thank you so much.
Thank you so much for having me.